All right, welcome to The Explainer. Today, we're diving deep into an unseen battle, one that's happening right now inside the lungs of millions. It's a condition so many of us have heard of, COPD, but maybe don't fully get. So let's break down what's really going on.
I want you to just imagine something for a second. What if every single breath you took was a struggle? I mean, really think about that. Like trying to breathe out through a tiny coffee stir, or trying to gasp in a new breath when you haven't even finished letting the last one out. Well, for millions of people, this isn't some thought experiment. It's their daily reality. It's a silent, constant battle taking place inside their own bodies.
And that battle, it has a name: chronic obstructive pulmonary disease, or COPD for short. Now here's the first thing that might surprise you. You'd think a lung disease is all about not being able to get air in, right? But with COPD, the real heart of the problem is actually about how incredibly hard it is to push the old, stale air out.
The reason it's so hard to get that old air out is because of something called, and stick with me here, dynamic hyperinflation. I know, it's a mouthful. But really, all it means is that air gets trapped in the lungs. It just gets stuck. And when that happens, the lungs are kind of permanently overinflated, leaving less and less room for you to take in that next good, fresh breath of oxygen.
Okay, so this battle inside the lungs, it's not just one single thing. It's really fought on two main fronts. Now, both of these paths lead to the same problem, that trapped air we just talked about, but they attack the lungs in totally different ways. We're talking about the two main faces of COPD, chronic bronchitis and emphysema.
And here's the absolute best way to keep them straight. Just think of it like this. Chronic bronchitis is an airway problem. Emphysema is an air sac problem. Simple, right? So one is clogging up the pipes, and the other is damaging the tiny little balloons at the very end of those pipes. But in the end, they both cause that exact same critical issue, trapping old air.
All right, let's tackle chronic bronchitis first, the airway problem. The drinking straw analogy is perfect for this. Picture the thousands of tiny little airways in your lungs. Now imagine those little straws are always swollen, inflamed, and just gunked up with thick mucus. Can you imagine trying to blow air out through that? It would be exhausting, incredibly difficult.
And you can see how this becomes a whole chain reaction. It usually starts with some kind of chronic inflammation, often from something like cigarette smoke. That inflammation basically tells your airways, hey, make more mucus, swell up. And of course they do. The result? The airways get narrower and narrower, and that leads directly to, you guessed it, air trapping. It's a really vicious cycle.
Okay, so that's the airway problem. Now let's switch gears and look at the other face of COPD, emphysema, the air sac problem. For this one, I want you to picture the millions of tiny, stretchy little balloons at the end of all those airways. Those are the alveoli. In a healthy lung, they're like a perfect bunch of grapes. But with emphysema, the walls between those little balloons start to break down. So instead of millions of tiny, springy sacs, you end up with just one big, floppy, useless bag.
And the way this happens is totally different. Yeah, chronic inflammation is the trigger again, but this time, it's not about making mucus. This time, that inflammation unleashes these destructive little enzymes. They're called elastases, and these things are nasty. They literally chew away at the elastic tissue that makes the air sacs, well, elastic. Without that stretchy structure, the little airways leading to the sacs just collapse when you try to breathe out, and boom, the air's trapped inside.
To really get a feel for what this air trapping is like, try this with me right now. Seriously. Take a nice deep breath in. Got it? Okay, now hold it. Don't exhale. And now, try to take another full breath right on top of that one. Feel that? That pressure? That feeling of being completely full with absolutely no room left? That is just a tiny glimpse of the constant struggle for someone with severe COPD.
So that's what's happening on the inside. But what does this battle look like on the outside? I mean, how can you actually tell the difference between these two conditions? Well, let's talk about the classic signs that doctors look for.
With chronic bronchitis, remember, it's the airway problem, the gunked up pipes. So it makes total sense that the number one sign is a cough. Not just any cough, but a persistent, productive cough. We're talking coughing up phlegm. The official definition is a cough that lasts for at least 3 months a year for 2 years straight. You'll also hear distinct sounds, like wheezing when you breathe out, and these snoring-like sounds called raunchy, which is literally the sound of air trying to get through those clogged passages.
Now, emphysema is a different story. Its main calling card isn't really the cough. It's this profound, deep shortness of breath. The medical term is dyspnea. And because the lungs are always overinflated with all that trapped air, something really interesting happens over time. The entire chest wall actually starts to expand to make room. This creates a very characteristic look that's known as a barrel chest.
And here's a really crucial point. This fight, it doesn't just stay inside the lungs. When your body is constantly struggling for oxygen, that puts an incredible strain on your entire system, and that can lead to some really serious complications.
For starters, both types of COPD make you much more likely to get pneumonia because it's just harder to clear junk out of your lungs, and both can lead to sudden, severe episodes called acute respiratory failure. But then, they each have their own unique dangers. With chronic bronchitis, the constant low oxygen can really strain the right side of your heart, causing a type of heart failure called cor pulmonale. And with emphysema, those big floppy air sacs are so fragile they can actually pop, causing a collapsed lung. That's a pneumothorax. Okay, I know this all sounds pretty heavy, and it is. But, and this is a big but, there are absolutely effective ways to diagnose this and to manage it. So let's shift gears and talk about how doctors figure this out, and more importantly, how we can fight back.
So when someone comes in with shortness of breath, a doctor will usually start with things like a chest x-ray and an ECG, mostly to make sure it's not something else, like a heart problem. And yeah, those tests can show hints of COPD, but they aren't the final word. The one test that gives the definitive yes or no answer is a breathing test that measures exactly how well your lungs are doing their job.
And it all comes down to this one magic number. The test is called a pulmonary function test, or PFT, and what it does is measure two things: how much air you can blast out in one single second, and the total amount of air you can breathe out from a full breath. You put those together in a ratio. If that ratio, that number, is less than 70%, that's it. That confirms there's an obstruction. That confirms COPD.
Okay, so once you have the diagnosis, what do you do? Well, the good news is there's a whole arsenal of treatments out there to help manage the symptoms. We're talking mostly about different kinds of inhalers, and they are fantastic. They do things like open up the airways, reduce that inflammation we talked about. Basically, they just make it easier to breathe from one day to the next.
But, and you really need to hear this, while all those inhalers are great for symptoms, there are only just three, things that have been proven, beyond a doubt, to actually reduce mortality. I'm not talking about just feeling better. I'm talking about actually changing the course of the disease and helping people live longer.
And here they are, the life-saving trio. Number one, and this one is the undisputed champion, is quitting smoking. It is the only thing that actually slows down how fast the disease gets worse. Number two, vaccinations. Getting your flu and pneumonia shots is crucial because those infections can cause absolutely devastating flare-ups. And number three, for people whose blood oxygen gets really low, is oxygen therapy. Using oxygen helps reduce all that strain on the heart and the rest of the body.
And this is maybe the most important takeaway from all of this. Yes, COPD is a chronic battle, and right now there's no cure. But it is not a death sentence, not at all. There are powerful, proven ways to fight back. Ways that let people manage their symptoms, have a better quality of life, and, this is the key, actually change the outcome of their fight.
Which kind of brings us full circle, doesn't it? The day-to-day battle against COPD is fought with things like inhalers and vaccines and oxygen, but for the huge majority of people with this disease, the real battle, the one that truly offers a chance for a longer and better life, it all starts with one single, incredibly powerful